Hi YouTubers and YouTubies, I'm getting ready to talk to you about gastric banding or the lap band, which is the procedure I am not getting. But I have information in my book all about it. So I thought if you're receiving the lap band, i.e. gastric banding, then this is information for you. Let's see. Preparing for the hospital, you have a checklist that you're going to want to make sure that you have. These are the most essential things that you need. You can add to this list, of course. You're going to want to have your advanced directive living will, 2 copies of that. And if you do not know what a living will is, that is the will that tells the doctors and your family what your wishes are in the event that you go comatose and have to have a breathing machine to keep you alive. You could choose to, if you can only sustain life through the breathing machine, through the living will, say, I do not want to be kept alive. Take me off the machine after a day or 2 days or 30 minutes or whatever. Or if it will keep me alive and there's brain activity and heart activity and this simply helps me, then leave me on the machine if the result would be death. Or just, I don't feel like dying ever. My family will just have to take the brunt of the cost of my choosing to stay on a machine until I come out of it. If I ever come out of it, that is your choice, and that's what an advanced directive living will would do. If you tell your family that you want something, the doctors don't know that, so they have no idea what it is you want. Your family can say anything they want to say because it's their will. My mother passed away, and her directive was, when she passed away, not to be revived. That was not what I wanted. Not that we fought in the hospital or with any lawyers over it, but it's not what I wanted. I wanted my mom. And I had to honor my mother's wishes, which meant I had to physically let her go. Emotionally, it hasn't happened yet. I still hang on to her very much. You're also going to want to have your CPAP machine if you require that, if you have sleep apnea, because you will be sleeping, if you can, in the hospital. So they're going to require you to have your CPAP machine. Having the surgery doesn't cure that. Oftentimes, sometimes if you require a CPAP machine, you will continuously require a CPAP machine. There goes my big lizard. There's the little one. It's getting bigger. You're going to have your CPAP machine if you require one. Your incentive spirometer, which is your blowing thingy, the thing you blow into to exercise your lungs so you do not get pneumonia. Medications in labeled Ziploc bag. The reason for that, this is the bag I'm going to use. The reason for that is you may have a change in your medications and forget to tell your surgeon's office. So the list that they have initially when you sign up is sometimes not the medicine that you're currently taking, or because you've added or subtracted something. So whatever the list is, if it hasn't been added to the list, they don't know that that's a required medicine. And if it's been subtracted, you could be given medicine that could potentially cause you greater harm than you're already in. So make sure that you take your medicine, not that they're going to use it, they just want to see it in a Ziploc bag so they can look at it and see how many milligrams it is, how often a day you have to take it, all of that. That's really important. You're going to want to take a robe and house shoes. On purpose, I got monkey slippers and a robe for this. I also got a nightgown I'm going to be wearing. You're going to want to take lip balm with you, and one of the reasons for that is while you're in surgery, they're probably going to have a mask on you. It's going to be blowing air into your face, drying your lips out. They're going to have sometimes a tube down your throat. That could cause your mouth to dry out. It's going to become a problem, so you're going to want to have lip balm. You're not allowed to have any fluids until the next day for gastric band anyway. You can't have anything until the next day. So you might have dry lips. So you're going to want to take that. Of course, you can add anything you want to the list. Remember that. Diet manual from your surgeon's office if he's given you one. If not, write down everything I say and take all those notes with you. I wish I could put a PDF on the thing down at the bottom where you look at the notes, where I put all my notes at for you, because all you'd have to do is print that up, and I'm not sure how you do that. You're going to want to have loose-fitting clothing such as pajama bottoms and sweatpants, loose shirts, stuff like that. My office said if you wear a bra, maybe you don't want to wear the bra, because you're going to have surgery and your stomach's going to be all swollen and you're going to be hurting, and who cares if you're not wearing your bra? You're going to be in too much pain. Do you seriously think you're going to be worrying about what everybody thinks if you're wearing a bra or not? I don't care. I think that if I'm going to be in pain, I don't care what anybody else is thinking. I want to go home and rest. This is big surgery. It's not something light. So you might not want to wear the bra, especially if it's underwire. They said don't wear an underwire bra. That'll hurt you. For your skin preparation, depending on your facility, you might have been given some stuff to wash your stomach down with. I was supposed to have been given stuff to wash my stomach down with on my last visit, and I did not get it. So you're supposed to have, well, this is prior to that. The morning of surgery, shower as you normally would, then take the Hibiciens, or however you'd say this, packets, which is what I was supposed to be given, and pour the soap into a washcloth. Do a 5-minute scrub from your shoulders to your pelvis with particular attention to the abdomen. What the girl told us was that you pretend like there's a square on your chest all the way down the sides to your pelvic area, and you're going to want to wash that really, really good. Avoid getting the Hibiciens in your eyes or ears, and do not scrub the genital area. Rinse thoroughly. It's really important you rinse it all off. Absolutely, ladies. Ladies, listen. No lotions. None. No moisturizers. No deodorants. No cosmetics or perfumes should be applied to your skin after you shower. When they go in to cut, they're going to be dragging all of that stuff into that incision, and that could cause you to have an infection. So none of that the day of your surgery. Absolutely no jewelry of any kind. The reason for that is if you swell up, they cannot remove this, and it could cut off circulation. Not only that, any medicines I give you could counteract in any metals that you're wearing, causing you to have a reaction with a rash or worse. So you don't want, and if they take you to something like an x-ray or something, they can't get this off, this will burn into your skin. So you don't want to wear anything, nothing around your neck, nothing in your ears, nothing on your hands, okay? Wear loose-fitting clothing the day of surgery. That's without saying, seriously, because you're going to have a swollen stomach, so wear sweatpants and a big blousey t-shirt going out. I'm pretty sure they're going to wheel you out to the front door, and then from there you're going to walk from there to the car. So you're not going to want to be bound up by jeans. You're not going to have a wire bra on that's going to cause you problems and irritate that area of your stomach. You're just going to want to be relaxed, and that's all they're looking for. Nobody cares what you're looking like coming out of there. For my facility for gastric banding, the nurse will call you back after you've arrived at the hospital and checked in, have you empty your bladder, which is going to the potty, and change into a gown. The nurse will review your health history, give you an ID bracelet, and start your IV fluids. That's great because they're going to stick me with needles, and I'm not looking forward to that. You'll be given your pre-op medications, which is Reglan and Pepsid through the IV to reduce acid reflux, which I do not have. Oral Bicitra, I don't know if I'm saying that right, to reduce acid in your stomach. It's very tart, so drink it back quickly. The nurse who was talking about all this stuff in this manual was telling us you just swallow it back and don't even think about it. You'll be given an antibiotic to prevent infection. That's really important. A Lovenox injection to reduce the risk of blood clots. The OR nurse and anesthesia provider will come talk to you, or should come talk to you, depending on your facility, then take you to the operating room, or a port will take you to the operating room. Please communicate to your anesthesia provider, mails in, any history of problems or complications with anesthesia at this time. I've not had any before that have had any problems, so I don't expect to have any now. Once you go to surgery, your family will go to the inpatient surgical waiting area or your room, or wherever your facility has them go. The OR nurse will contact your family when the surgery starts, and the doctor should speak to your family and or friends after surgery for an update. So it's important that your family is in the correct area for waiting, whether it be your room or a waiting area specifically designated for the surgery, for your surgery. The incentive spirometry is the last thing I'm going to talk about on here, and that's that blower thingy that helps you not get pneumonia. It is a breathing exercise designed to help you take long, deep breaths, such as when you yawn. The incentive spirometer shows you how well you are taking deep breaths and expanding your lungs because it makes you breathe deeply. It improves your ability to clear mucus from your lungs. It may also increase the amount of oxygen that gets deep into your lungs. Taking long, deep breaths may help reverse or decrease the chance of developing breathing pulmonary problems following surgery. Your goal is based on your weight and height and should be written on the bottom of your incentive spirometry. Mine has it on the bottom that I'm supposed to breathe into it 3 times a day for 10 days. I do 10 times a day for 10 days. That's just my personal thing. The incentive spirometer has no medication in it, so you won't overuse it. You should do 5 to 7 deep breaths every 2 hours. It's going to be after surgery. They're going to make you do this after surgery, or they should anyway, so that you do not develop lung problems and pneumonia. You'll be asked to record how often you've done the incentive spirometer exercise while in the hospital. Now, if your facility is not requesting that, I would, as a note, take some paper and use this thing that you're blowing into and record every time that you do it. I realize that if you're not required to, you don't have to, but seriously, if you do not want complications of pneumonia, it will not hurt you to do this. This is what keeps you from developing pneumonia, breathing into that machine, that thing, that plastic thing. There's a form in the back of this book that I have that I'll be able to write down what time I did and for how long I did it and how many times I did it. And my doctor is going to be looking for that piece of paper and the fact that my incentive spirometer is with me or near me. He's going to want to be seeing that. Remember to hold your breath for a few seconds after breathing in and then let it out slowly. Your incentive spirometer goal will be the same as preoperatively and postoperatively. If pain after surgery prevents you from breathing deeply enough, use your PCA or ask your nurse for a booster of pain medications. So you got to remember, this is not going to be easy for you to breathe like that because you're breathing out, and breathing out pushes your lungs, push on your belly's swollen, it's sore, it's just had surgery. It's going to be super hard for you to breathe, but you're going to have to if you have that device. Practice your IS at home. It will help open the smaller airways in the lungs before surgery, and you'll be able to better remember how to use it while you're in the hospital. You should do all of your IS exercising sitting up, not lying down, or laying back in the chair either. You want to be sitting up because that's what they're going to make you do if they make you do it. You've got to sit up and do it, and they want to see that, and they're going to monitor that. That's not all for gastric banding yet. I still have some more stuff I wanted to talk to you about that's still in here, like the hospital stay and what to expect, and activity afterwards, exercising, types of exercises and when you can do them. Stuff like that. So, and then the next phase that I'm going to go through, and it says incentive spirometry again, but it's the same page. Then the next thing I'll be doing after that is the Roux-en-Y gastric bypass / gastric sleeve general information to know, which will be very, very similar to this video, except there's a slight exceptions in the fact that these 2 surgeries, or 3 surgeries, the Roux-en-Y and the sleeve are going to be on the same type of thinking, but the band is not. So this is for the lap band. I got more coming. Thanks for watching, subscribing, commenting. Keep them coming. Have a great day, everybody. Bye.